Yo, welcome guys. Today I'm very excited to share this video because we're going to be talking with one of our top consultant ophthalmologists in TTH, and he's going to be telling us some of the things that we need to consider before we choose a specialty, a medical specialty. So if you want to know more, stay tuned and let's welcome.
My name is Dr. Gilbert Batieka Bonsanna. I'm a consultant ophthalmologist at the Ophthalmology Teaching Hospital, and I'm also a senior lecturer and head of the Department of Ophthalmology at the UDS Medical School.
Thank you very much for having us, and we are very grateful for you giving us this opportunity to learn about how we are going to choose a medical specialty, because it has been a difficult choice or problem for most of us in medical school. So thank you very much. Thank you.
You're most welcome.
Our first question for today will be that can you take us through your journey towards becoming an ophthalmologist?
Okay, thank you. To become an ophthalmologist, as usual, you have to be a medical officer. Once you become a medical officer, you can now apply to do residency in ophthalmology. You can either do it in Ghana here or outside the country. Normally, the residency in ophthalmology is just like any other residency or medical subspecialty, where you do 3 years for the specialization or the membership. And then you may go back 1 or 2 years to do what we call a fellowship, and then you become a fellow or a consultant. So the coursework, usually for the first year, you do the basic sciences and refraction. Third, you do paraclinicals. Second, you do paraclinicals, and third or fourth, you do mainly clinical work. So the duration of training for ophthalmology is the same as all the other specialties.
I want to ask, what are the things that you've seen that we should consider when choosing a medical specialty?
Yes, so that has always been an issue for most of us. Even before I chose ophthalmology, I wouldn't know what exactly to do. But I advise that as you rotate through all the medical subspecialties, you have to look out for those that you develop interest in. It is true that as you move from one rotation to the other, your interests keep changing. So you move from A to B to C rotation, your interests keep on changing from one to the other. But at the end of it all, when you are done with all the rotations and you are done with your house job, there will be one that will stand out that you always want to go back. Though that might be one of the first that you would have done, but you always want to go back to that. So what it means is that your interest is the most important. Where your passion is the most important. Most of us tend to follow the crowd. We tend to follow our friends. Once a friend say, I want to do subspecialty B, then you also say, okay, me too, I'll do subspecialty B. But that may not be your passion or interest, or just because a friend. So peer pressure is one thing, but then it's good that you follow your passion rather, and that is where you can do things that no one else would have done, and then that is where you get your breakthrough. So the more reason why you have to go through all the subspecialties is to expose all of you to these subspecialties. We know that you do some of them for a longer period of time than others. So those that you do for a longer period of time, you are more likely to develop interest in those than those that you do for a shorter period of time. All the same, if your interest is in any of the subspecialty, you will recognize it immediately you start that program, and by the time you are done with it, you know that this is where my interest is. As you move on to other subspecialties, you may change your mind, but you may always come back to that particular one. And once your mind keep on playing, then that's most likely where you belong. The other thing is that when you are doing your house job, try to spend time at some of the subspecialties that you think you have interest in. And now, because when you are doing your house job, you more or less own the patients. You have a primary responsibility to the patient, and you follow up and treat the patients. Unlike when you are a student. When you are a student, you don't have any responsibility to any patient. But as a house officer, you have that responsibility. So that is where you will now realize that, yes, my interest is really in this area, and then you can go ahead to offer it. I would advise that we should not follow the crowd. Money shouldn't be one of the things we should be looking at when choosing a subspecialty, because any other subspecialty Once you do it well and you apply yourself and have the right attitude, money will automatically come. You know, some of us say that, okay, this subspecialty, there is no money. This one, there is money. And they will say, okay, because there is money in subspecialty A or B, that is what I will go and do. And once your friends say, oh, me, I'm going to do this, I'm going to do that, you say you are going to do the same. But money doesn't work that way. If that is the case, then people who are not educated shouldn't even be rich. But there are a lot of people, a lot of rich people who have not stepped their foot in the classroom. You know, a lot of people who are not doctors, who are richer than doctors. You know, a lot of doctors who are in particular subspecialties. Some are rich, some are poor in the same subspecialty. You know, so it's not about the specialty as such. Money comes with attitude. So all the subspecialties, there's the potential to make money in any of them once you have the right attitude towards money.
Yeah, Doc, I really appreciate what you're saying, because some of us enter medical school with this biasness, because we feel like surgery or internal medicine are the only ones. We are just too biased towards those ones coming in, and we even forget to even look at other options that are available to us. We just focus on the two, thinking that we can only be surgeons or internal medicine people. I would like to also know, were there any challenges, or are there challenges that you think that we might face when we are about to choose some of these specialties?
Yes, there will be challenges, because sometimes the first challenge is yourself. You know, to overcome the hurdle that no, I don't have to follow the crowd. I have to choose what I have passion for, so that when the things get tough, you will still have that passion to stay in that subspecialty, and you will not be rude to patients. You still be nice to patients and still work with good ethics. If you choose the wrong subspecialty or wrong area, then when things are tough, you may get fed up and start not being nice to patients, and you start developing wrong attitudes. So the first thing is to overcome the hurdle of not following the crowd. The next thing is to know that all other subspecialties, provided you have the right attitude, you can get rich, or you can have enough money to take care of yourself and your family. In all other subspecialties, it's just about your passion in that area. Any business that you are doing, if you do not have passion in that business, you cannot succeed. You know, it's the same with the medical subspecialty or in medicine. If you have passion in what you are doing, you are likely to become successful. You know. Now the next thing is some of the subspecialties. If your passion is not there and you go into it, the learning can become troublesome, because you need to learn more details. You need to go delve into more details about the program, so you spend a lot more time in the program. All your time have to be dedicated to that particular program during your residency. So if you don't have interest in that area, and because friends are going into it, you also go into it, then you may not have that passion, and therefore you may not dedicate all your time to learn all the nitty-gritties in that subspecialty. And therefore when you qualify and come out, you may not be the top-notch specialist that you would have loved to be. So these are some of the roadblocks. Generally, the other roadblocks are similar in all other specialties. As I said, you need to get some money to get some books and some equipments that you may need to use during your training. As for the duration, all the subspecialty, the duration is similar. 3 years for membership, and then for fellowship up to 5 years. But some subspecialty are a straight fellowship, where you do 5 to 6 years straight away. You don't come back and go. You know, some specialties like neurosurgery, they combine it, so you don't do and break and come and go back. You just do the 5 years or 6 years straight. But ophthalmology, ops and gynae, ENT, and other subspecialties, you can go for 3 years, come and go back for your fellowship, or you can even do the straight fellowship if you also want. So it's stress. Some of the specialties can be stressful. All the subspecialties actually can be stressful, because all of them require time. You need to stay awake, especially the surgical subspecialties, including ophthalmology. Suddenly you have to run nights. You also run nights in medicine, but you may not go to theater or do surgery. In surgical subspecialties, you may have to go to theater at night. You may close very late, midnight, or even early in the morning, have to be back in the ward again to cover for the ward. So they can be very stressful, finances, you can have financial challenges, So, and sometimes too, when you are done with a house job and you start your MO ship, and you're not able to save enough money, and you go, then you may have financial challenges sometimes, But then the earlier you go into the subspecialty, the better. So you can finish early and come out to start working for yourself or for government.
With regards to the finances that you mentioned, are there ways that we can try to go around it?
Currently, the Ghana College of Physicians and Surgeons, you don't pay fees. Okay. Yeah, they waive the fees. Initially, you had to pay fees, but now government has waived the fees because residents had to agitate and say, we are working for government. Whilst you are in residence, you are actually working as a doctor. So why should we be paying fees for working for government? So the fees have been waived. But some of these financial challenges we're talking about are like buying electronic books, or buying a computer, or buying a laptop, or buying some equipment. Like in ophthalmology, you may need to buy an ophthalmoscope. You may need to buy maybe a direct, indirect and direct ophthalmoscopy and all of those things, which are involved in other subspecialties. You may need to buy a few things here and there, and your movement up and down, because some of the times when you are going, if you are not living in Accra or Kumasi and you are going to Accra or Kumasi, then you may need to get accommodation. You may have to go and rent a house or a room, or you may share with friends. If where you stay is a bit far from the training center, then you have to take transport in and out. If you have a car, fine, but you have to buy fuel. If you don't have, they may have to take taxi or truck in and out, and all that can be challenging. You have to eat as well. You have to buy food, or you may have to cook for yourself. So these are some of the challenges that you may have. But then in life, all these challenges will always come, irrespective of where you may be. Even if you're still an MO, wherever you are, you still have to feed yourself. Though as you are working, you'll be getting some money here and there, but it can still be challenging.
Okay,
now, in some instances, you can secure a scholarship. Okay. So like, for instance, I went to University of Nairobi, where I had a scholarship for my studies. Some people also went to South Africa and other universities where they got scholarships. But if you're in Ghana, the scholarship is waiving your fees. They waive your fees away. And then depending on the hospital you are in, they may sponsor you. And when the hospital sponsor you, your salary will remain intact. So you keep on getting your salary. Some hospitals may even give you accommodation or some allowances whilst you are doing your residency. Others too may not. So those are some of the things we need to explore to see what benefits you may get. And then some of those hospitals require that you come back to serve them. So if you are ready to do that, then you can sign such agreements where they can support your training, and then you come back to serve them for sometimes between 3 to 5 years. Yeah.
Wow. Doc, that has been very, very wonderful. Initially, I thought that you just have to use your own money to further your maybe the residency and all those stuff. But then I've seen that there are possibilities that we need to explore more to open our brains wide and clear. Is there any advantage or importance to we deciding which specialty you want to go to early?
Yes, it's good to decide where you want to go to early. If you have the opportunity, then it's better. The earlier you do it, the better. In other jurisdictions, there is nothing like house job or being a house officer or even being a medical officer. Once you are done with medical school, you enter into residency straight away. So whilst you're in medical school, you choose your subspecialty area or the area that you want to specialize in. So after med school, you go to write the exams, or you go for the matching and all that, and then you go into the subspecialty area, you know. But because here we lack doctors in the rural areas and some urban areas, then they have to find a way to keep doctors working, and therefore house job was instituted. House job was actually 1 year. It used to be 1 year, you know, and then after your 1 year, you move on to specialize. But they realized that there were no enough doctors in their districts, so they had to increase it to 2 years, so that the waiting period will be longer, so that we have a lot more doctors going to serve in the district, to serve as middle or let's say lower manpower for the doctors. And then now they came up with a MO-ship, where you now, after house job 2 years, you now become a medical officer. And the medical officership was after 1 year you can go and specialize, but with time they made it 2 years. Now in other deprived subspecialties, or subspecialties that don't have so many numbers, after house job you can go into that subspecialty straight away. But in those areas that they think we have enough numbers, you have to do the 2 years house job and do 1 or 2 years MO-ship before you can proceed. Yeah. So if you have the chance to go early, the better. Now the advantage of going early is that you specialize early, be a fellow or a consultant early. So in your prime age, when you are a fellow or a consultant, then you have more to give back to your nation, and you stand to benefit from the fruits of your labor, you know. But if you go late, then you are almost getting to retirement when you become a fellow or consultant. Then you may not have much to deliver, and you may not work for too long before you retire, unless you decide to go into private practice. But now when you are a bit old, the energy you have now, you may not have it again. So you cannot work for long hours, and you cannot make an impact on your peers or on your colleagues that much. So the earlier you go, the better. But there are many reasons why people may go or may choose that subspecialty late. Some can be financial, some can be social, some can be relationships, and what have you. So there are many reasons, you know. But then the earlier, the better.
Doc, since you're an ophthalmologist, we would like you to just give us, why do you think we should choose ophthalmology?
Yes, ophthalmology is a niche. I mean, you create a niche for yourself when you do ophthalmology. You know, when you become a house officer, if you are very serious, you would be able to do a lot of the procedures in the 4 major specialties. So in general surgery, internal medicine, obs and gynae, pediatrics, because you rotate through those areas, and you would have spent a lot more time in those areas. By the time you become a medical officer, you'll be able to do a lot of the basic procedures in these 4 subspecialties. You see, so as a medical officer, if you decide to have a practice, most of the time your practice will be based on these 4 areas where you see patients. So you are already somehow proficient in these places as a medical officer. But I realize that when it comes to the ophthalmology or the subspecialties, most people are lacking in those areas. So if one should do ophthalmology, for instance, then you have an added advantage. So therefore, when you complete as an ophthalmologist, you can still function in the other subspecialties and function fully in ophthalmology as well. Ophthalmology would be more like a niche for you, you know, because the other 4 subspecialties, all the other colleagues also have knowledge in those areas. But when it comes to ophthalmology, it's more or less not as much to function, you know, optimally. So as if you are the only ophthalmologist, then all cases will be referred to you that has to do with the eye. You see, but then if you have done, let's say, obs and gynae, for instance, now if you are an MO and you are very good in your CS, you can still do the CS. You see, now it means that you will be competing with the obs and gynae for cases of CS, cesarean section, and other, you know, medical conditions. If you are an internal medicine specialist, the medical officer also compete with you for some cases, except the cases, the moribund and difficult cases that he cannot handle, that he will refer to you. You see, so chronic kidney disease, terminal, end-stage kidney disease, end-stage heart failures, and liver disease are the ones that you will now be dealing with, and they'll be dealing with those that are not too advanced cases that they can still manage. You see, now if you are a surgeon, a medical officer who took their general surgery rotation very serious, will still be able to do hernia and other common surgical procedures, and therefore the person will be competing with the surgeons for such cases. You see, if you are a pediatrician, the medical officer will still compete with you for the pneumonias, the malaria, and all of those things. But if you are an ophthalmologist, a medical officer cannot compete with you for any of your cases. You see, so it's more like a niche for you, because everyone else will refer such cases to you. But for the other areas, it is only when it's beyond them that they will refer. But for the ophthalmology, whether it's beyond them or not, they don't want to touch, they will just refer them to you. So you have an added advantage if you become an ophthalmologist. And remember, you can still deal with the general cases that you used to deal with as a medical officer. So if a patient comes with malaria as an ophthalmologist, you can still treat the malaria, because you've not lost that skill. Any skill once learned, you just have to improve upon it, and you may never, unless you are not serious with those areas. So ophthalmology is more or less a niche, for people who decide to go into ophthalmology. Yeah, so that will be an advantage of going into ophthalmology instead of the other, areas of specialization.
Okay. Thank you very much, Doc. We really appreciate the information that you shared with us today on how to choose an ophthalmologist. I've definitely learned a lot, and I'm going to explore ophthalmology out and other specialties so that I can better make an informed decision. Doc, thank you very much. We really appreciate your time. Thank you very much, Dr. Gilbert Bonsanna. We really appreciate your time and the information you've shared with us today. Thank you, and we'd love to have you another time. To our viewers, if you really enjoyed this video and then the information that we've shared with you, try subscribing, like, and share this video. See you next time.